Okay, so let's talk about therapeutic applications. But before that, I want to kind of take you on a journey to understand how the people get that pain, how is it become so bad, and what is the trigger point, and how we can sort of turn off that trigger point. So to start with this, I found somewhere a very old diagram, and I just thought that is exactly it, because you could see a danger, a representation of danger, the snake, our prime, prime ancient self. When we were living in the nature, we were learn through evolution how to cope with this danger. So immediately the process is quite familiar to you. You see the danger, you want to run. And when you want to run, what is happening? Because visually we process the danger, and it immediately signals to start the fight or flight response, which makes the blood flowing to our muscles, heart pumping fast, and giving you all possibility to escape this danger. So what was fascinating is to learn that nowadays in a modern society, of course, we don't walk on grass with snakes every day in our life, but we recognize danger as other elements: stress at work, stress at home, the situation we might be exposed to, like severe load with electromagnetic field, yes, or what you might consider unusual, severe, emotional stress. And or of course, typically, like you're exposed to this horrible virus, which is all around, yes, big physical stress on the body through the pathogens, or you've been having a trauma, and the body always goes through this recognizing danger response. So for you, I just put it there divided into two categories. First of all, when you are in this exposed to danger response, number one, what is happening is that your body harvests all the energy it can, because you need to run away from danger. So regardless, as I said, we are now in a modern society, we still operate on the same path. So to harvest the energy, what's happening? The body starts breaking down the sugar available in the blood, for example. Then, of course, it goes under glycogen stored in the muscles, in the liver, and the body creates new sugars to get the energy, quick energy. Once it's done with sugar, it goes for fats. Once it's done with fats, it goes to break down amino acids, the process called catabolism. So when the body is broken down in order to sacrifice and make energy. Of course, this is an emergency situation, and it's understandable. So together with this, can we run expensive inflammatory process? No, we cannot, because inflammation, remember, always comes with red hot, swollen, painful, which all processes require energy to maintain. And so the body cannot afford these expensive energetic processes, so it's going to shut down. So although it needs to be inflamed, the body is not inflaming it, and the body is not sending white blood cells. They're not producing the migration of the blood cells, decrease phagocytosis, decrease actual lymphocytes production. So this is very interesting, because at this point of time, you just need to survive. And of course, all your resources are redistributed. So red blood cells will be sent to muscles, blood flows out of organs and sends to muscles, yes? And white cells will be suppressed. And there will be also decrease insulin sensitivity, because you don't need store sugar, you need sugar out and being broken down into energy. And of course, this process is closely linked with hormones, cortisol, as you know. So will be increase in cortisol production, at the expense of other hormones shut down, like thyroid, the sex hormones, because procreation is not when you run out of danger. And of course, this process is driven by sympathetic nervous system out of autonomic nervous system, as you can imagine. So what is happening again with our modern society? In our modern society, we basically become stuck in this process. We have ongoing stress response, which is like the body never stop running for some reason. And all this process mediated by prime hormone epinephrine, which you understand as adrenaline. So when the body is in this sympathetic overdrive, what it continues to do, it continues demand for energy, right? Because it's never switched off. So how much you can burn your body energy? You burn your body energy, and you need replenishment, yes, but you can't get replenishment because you're unable to digest. So there will be decrease of energy in the whole of the body. So this is what we call about the potential. Potential across the membrane of the cell represents that vitality, that potential, which in summary, all of the cells, the potential drops. It's like your battery flat, okay? So second process, of course, it's difficult to maintain blood sugar because, you know, instantly whatever sugar you have, it wants to go and break down. So you have cravings for sugar, you have demand for sugar. And of course, with this, it affects also cholesterol, you have high cholesterol. And at this point, dear colleagues, what I must say, that if you're gonna go to ordinary GP who doesn't understand this process fully, and they see, typically what they see, oh, high blood sugar, high cholesterol, you have diabetes, yes? So let's put you on statins, let's give you metformin. This is not the attitude we want. We want to look into and understand, maybe the body is stuck in this sympathetic overdrive. So if the body is stuck in this sympathetic overdrive, we need to get the body out of it in order to resolve this conflict. Because if you don't address this, all your treatment will be very symptomatic. So remember what we said, the body cannot afford inflammation. So the bacteria blossoming, it's everywhere. Everywhere where there was a chronic inflammation or there was a weak point, like say sinuses, suddenly people start having sinusitis, yes? Or very often cystitis is another one. That's where the bacteria likes to be sitting in those pockets, dental problem. So all this chronic inflammation also siphon energy, but the body cannot produce a proper big inflammation in order to resolve it, yes? So the chronic inflammation overwhelms the body, and it always comes with pain, of course. Together with this, there will be gastrointestinal disturbance. Like, for example, the food which comes into our bodies when we in sympathetic overdrive. You know, the gut has lots of epinephrine receptors. So it's not surprise to you because you have even saying, you know, I feel it in my gut, you know, like when you're scared or some stress happening. So basically the stress hormone parks on the gut receptors. Think about this. So what's happening? The gut will become reactive, yes? So first of all, you cannot digest food properly. You cannot break it down properly. There is not sufficient peristalsis. And because of these food particles, food protein, undigested protein, they create a mass which has not been able to be properly reabsorbed by the body, and it stays there. It ferments, attracts bacteria, create gas. That's why bloating. And they also, with this gas, you know, it pushes the shift the valve in between esophagus and stomach. So acid goes into the esophagus, you have heartburn. But paradoxically, heartburn happens when the acid actually low in the stomach because there is not enough production of the acid. So of course, the first thing they do, they give you omeprazole, and that is the wrong thing to do, because you need to give hydrochloric acid and pepsin as a supplement to address this. Plus, all these undigested particles will cause you the allergic reaction. So we start creating food intolerances. And of course, with food intolerances, what is happening is you go to nutritional therapists and they tell you, stop eating this, stop eating that. And what's happening? You already cannot absorb food and make energy out of this essential aspect. Plus, you start restricting your diets, you stop receiving essential, again, amino acid, fatty acid, vitamins. So altogether, your body getting flatter and flatter and flatter. The battery of the body getting flatter. There is no resources. People become more and more unhealthy. They don't have adequate rates of recovery, repair if there is an injury. So it's become slow process. The body is so become impacted by the oxidative stress, or organs stop being able to function properly. Because remember, blood always goes to the muscle, it not nourishing in the organs, so organs become weak and inability to detox. So with that, what you always see, it's a poor quality of sleep. So if you ask these very questions, what is your sleep like, or how do you sleep? The people immediately will start describing to you that they can't fall asleep, or they keep waking up, or they feel very, very unrested when they wake up. And of course, this is of course, the first question what I ask to identify is somebody in sympathetic overdrive or not. It's their ability to sleep. If you keep going like this, not only for days, weeks, months, but even years sometimes, you inevitably reach the adrenal exhaustion, the state of the stress response reaction when the cortisol become low and all the hormones become low. So with this, you have hypothyroidism, which then slow down metabolism, and people start gaining weight, yet they absolutely flat, no energy. This affects sexual glands, all male and female, and people, both sexes, will tell you about their low libido. There will be hormonal dysregulation and low production of melatonin. Melatonin is a hormone for regulating circadian rhythm. And as you know, circadian rhythm intimately linked with hormonal rhythm. Like when you wake up, you're supposed to have high cortisol level to help you to wake up, and low melatonin level and high testosterone level, yes. And at night is opposite, high melatonin level, low cortisol. So these patterns flips, and this is all become dysregulated. Doesn't help our lifestyle. I'm not talking about just lifestyle. So anyway, and people gain weight where you think, oh my God, I'm burning all the energy, I should be losing weight. So this is a paradoxical situation. You need to recognize this sympathetic overdrive. If there is a sympathetic overdrive going on, so I tell you, there is a one and only one good solution to this. And this solution is InterX, yes, InterX, our tool. Because InterX, what it's doing, this is a representation of autonomic nervous system working in balance. So when you wake up, your sympathetic system goes up, you active, you do all the activities, also fight and flight. Yes, remember we just discussed that. All that driven by sympathetic and parasympathetic, opposite system of the rest, sleep, digestions, and all the parasympathetic activities which we discuss later. So anyway, the point is, so when this is always up and high, it suppresses parasympathetic system. So InterX, the only tool, I tell you from my personal experience and studies we have done, that within 10 minutes, you can stimulate parasympathetic relaxation. After 10 minutes of stimulation, we recorded on EEG, there is a very strong tone, parasympathetic tone. So what effectively you're doing, you're switching that switch from on to off, okay, when you work with InterX device. So pain always associates with ongoing sympathetic overdrive. Pain, it's like chronic pain. When you have pain for a long time, it's always driven by epinephrine. So non-invasive interactive neuromodulation causes deactivation of sympathetic responses through autonomic modulation and activation of the parasympathetic nervous system associated with sleep, relaxation, and better digestion. Remember, this is 3 domains: sleep, relax, eat. That's a little bit diagram to remind you what happening in pituitary gland, the center for autonomic regulation. So you have water balance, stress balance, hunger balance, reproduction, thermoregulation, sleep-wake cycle, optic, the vision, and pituitary, yeah. So right now, I just want to show you this little diagram. This is representation of how InterX stimulating the skin with the fibers, and it goes through the dorsal horn of the spinal cord, and from there, spinal reticular spinothalamic pathways gets into different parts of the different nucleus of the brain, reaching the cortex. So this is the stimulation with InterX. So let's look now actually what is happening when we stimulate it. So I put the InterX on the skin, right? InterX produces electrical stimulation. Is this normal for the skin? No, it's not. This my skin reads it as danger, right? It's a nociceptive, noxious stimulation. So when it's a danger, my body switch on my autonomic response. So first of all, when you stimulate in our skin, there's a plenty of nociceptors or receptors which feel pain, so to speak. Yes, they're cutaneous receptors. So we also have these receptors inside, not only just on the skin, but typically tiny little C receptors are situated in the organs, internal organs, but mostly around the skin. It's A delta and A beta receptors. A delta is a medium caliber, A beta is big caliber pathways. So A delta also feels pain, but also itch and temperature change. That now immediately think of your complex regional pain patients. Yes, they have altered perception of temperature, and always they want to scratch some areas which are not right or affected by the process. A beta is a bigger, more lots of connective tissue shielding around like Schwann cells. Yes, A beta, and they also, apart from pain, they sense also touch, pressure, and vibration. Again, complex regional pain syndrome, pressure. And often this condition comes when they put the cast, surgeons put the cast and it's too tight. So when we stimulated these receptors, remember what I was saying, it's the information travels to the dorsal horns of the spinal cord. And at this point will be some release of the opioids, yes. And then it travels up through spinothalamic spinal reticular pathways. And here they reach in their autonomic center for autonomic regulation. So and then to the cortex of the brain. The response will come both ways. First, you're gonna have activation of the sympathetic response, sympathetic nerve activation. And then after a while, there will be parasympathetic activation. I told you in about 10 minutes. Together with this, what's happening? Look at this activation of the immune cells, hormonal cells. Yes, this is adrenocorticotropic hormone release. And then these immune cells will, and cytokines will come to the point of injury. So neuropeptides, cytokines, chemokines, all of it will be released in the bloodstream, and they will travel and released locally as well. And stimulation of the endocrine system. So stimulation of noradrenaline, perhaps cortisol, depending, yes. So, and in turn, this is all interlinked, interconnected with the central nervous system, with the immune system. So all this called nice neuroimmunoendocrine cutaneous network. So the whole body responds to this stimulation. So in this non-linear, in all direction, relationship and stimulation causes the neurohumoral response. Neurohumoral response, it means the response through the nerve and through the response through the chemicals, your inner chemicals through the blood. So this disruption of homeostasis by injury or inflammation activates all this program of neural, hormonal, and behavioral activity aimed at returning homeostasis back into balance. So this is a source, the book you should read. So with this in mind, with this understanding, I want you to understand that the first thing you should do is you need to do the switch. You turn the switch off. Yes, you need to stimulate with InterX, and particularly you want to stimulate and target parasympathetic nervous system. Where the parasympathetic nervous system in the body? Well, you know perfectly well, vagus nerve, it's the main nerve of the parasympathetic system. You also know, if you look at the diagram, that if you look distribution of the branches, the all parasympathetic branches mix with sympathetic in the neck, lots of parasympathetic branches in the stomach, and mostly, primarily parasympathetic nerve branches of the peripheral nervous system in the end, the tail of their spine. So pelvic organ innervation. That's why I always say, that's why when people make love, they want to sleep afterwards, because they activate their parasympathetic system. So what we're gonna do with the InterX, first of all, my recommendation to you, always go to the head, regardless where the pain is, like neuropathic complex pain, you need to start with activating the scalp, face, because in the face we have exits of the trigeminal nerve, which will send information straight in the brain, yes? So I'm gonna show you in a minute. So scalp treatment, trigeminal points. Then of course we target the abdomen for gut-brain relationship. And then of course we're gonna target the bottom of the tail of the spine, pelvic area. Also, I'm going to give you some neuropathic point protocol, source protocol, reflex zones. So let's have a look. So remember when to use these zones, parasympathetic zones, I call them zones. So the application area, it's where you need to use them when you recognize there is a sympathetic overdrive. And remember what question you need to ask? What is your sleep like? Yes. If people don't sleep, you understand they're stuck in the sympathetic tone. So historically, you say, well, how long is your neuropathic pain? And they say, oh, very long. People like this will be overly sensitive. So you cannot easily palpate, like say trigeminal neuralgia, that branch is inflamed, yes? You cannot touch because there will be agony pain for them because you activate these touch receptors. Yes, so overly sensitive, or people with fibromyalgia, they're overly sensitive. You cannot touch like this. Not only overly sensitive to touch, they're overly sensitive to food. They will be just overly sensitive people, full stop. Maybe emotionally, they will be like, you cannot say anything. They go and burst into tears, or they take it very personally. This is also expression of that. So this is 6 points on the 6 points on the face. Let me just show you exactly where these 6 points are. I stop for the moment share. Yes. So if you could see me, this is my face. So the branches, mandibular branches are here. So you see the end of the mouth. You take your classic electrode and you put like this, slightly at angle, both sides like this. Okay. So the point will be right there. So you will be targeting this point this way. Second set of points here. You feel these orbits around the eye. Yes. And if you palpate the orbits, there is a little bit of like a notch here, like there. Try it on yourself now when I show you. So it's quite sensitive. Often it's quite sensitive. So it's there. So you need to take half of the electrode and place it this way. So you can see half electrode hanging and half is in good contact. But it's on the point, but it's not preventing me from moving my eye. Yeah. So one point and the other is here. So you target this point here. So if you look at the nose, and you'd feel it's always like a little, you actually feel the exit of the nerve to the cranium. So next one is you look of the orbit above. So it's there because there will be like a little incision there. And this is the point you need to target. How to target this point? It's good if you lift the eyebrow up and out. Yes, and then you stick this electrode like that. Half of the electrode in skin contact and half is not. Okay. So up and forward and you target. Okay. So when you target these points, please get it right. I saw somebody copy it on the internet and they didn't know what to do. And they said, put it there. No, you really need to get to this point here. So it's there. Either this angle or this angle, it's up to you. So we are back on the track, yeah? So these 6 points exit of the trigeminal nerve, you can look at the anatomical map. So we use classic electrode and we use your preset 15. Remember I told you preset 15 pulse per second is under the yellow box of the chronic preset. And it is to be used with any neuropathic or hypersensitive pain, okay? Also, 15 pulse per second is the lowest pulse, so it's very slowly tapping the skin, yes? And very slowly tapping the skin and create, stimulate the nerve and create relaxation. So I recommend you to do this for 2 minutes on each point, yes? It will take 12 minutes, but it gives you instant, really nice relaxation. Remember to keep your device at the very comfortable tingle, or if they are hypersensitive to vibration level, just very pleasant, like little like vibration tapping, like slow tapping. Then you can use the second electrode, which is called comb electrode. And you will be working using this comb over this hair. So same preset, you can use same 15%, or you can use 15 to 60%. It's the same time, will take you approximately 10 minutes, yeah? But the important thing about this technique is that when you go, you could see the diagram shows you how to drive this comb electrode. You go from the hairline from here all the way to the end of the hairline. So we call this technique watermelon because of the kind of stripes you're gonna create. So you go center, then you go right, then you go left, and then you expand more rights, more left, rights, left, until you get to these points like that, yes? So, and every time you end up being in this point here, in the occipital fossa at the hairline. This is important acupuncture point, so you want to stimulate it a lot. Practically, before you start doing this technique, you need to comb patient's hair, otherwise you won't be able to get with this through. And another thing is that when you slide, sometimes if people have very oily hair, you won't be able to get sensation through. So in this case, what my recommendation is that you work like you place you few seconds, say 5 seconds, 1, 2, 3, 4, 5. Next step, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and so on, and so on, and so on. So you do it in steps if you can't get through hair. And also to look out, you look out for places which are sensitive. For me, I mean, not on me, but in my patients, I always find here on the gallbladder meridian here, lots of time it's sensitive. So place, place, place. So when you get to sensitive point, you may want to stay longer, or you can just do the same brushing off technique, like you wiping the stickiness off. And remember this, you should all practice on yourself to understand what patient's going to feel like. You will understand. Both techniques are very, very nice to receive. They are very pleasant to receive. Unless people have, you know, severe trauma, brain trauma, which may alter the perception of pain. In regular situation, it's pleasant to receive. If it's unpleasant, then you just do this technique very gently on vibration level and only focus on those points which are unpleasant. So second zones, remember I told you we have mixed fibers on the neck, so very easy just to put the flexible array to this area and use cycle 3. Cycle 3 is low frequency cycle, so it would be appropriate to use with this complex and neuropathic patients. And 10 minutes, then you could do 10 minutes in the low abdomen. Again, this is a pubic bone, so you need to position so you touch the pubic bone, because then you know you target in right places, yes? And sacrum itself on the back. So this is all like 30 minutes in addition. And you could use also so-called parasympathetic switch. It's from acupuncture. Remember you probably heard about how acupuncturists put the needle and patients become anesthetized and they can withstand the whole procedure, the whole operation without any painkillers. So this is a point. So if you look, it's in the middle aspect of the wrist, yes, approximately around the inch. So if you slide your finger, there will be like a tip. It's in between two tendons here, in between two tendons. So when you slide, you feel the dip. You can very easily find it with InterX. You slide and it's going to stop at this point. So this is pericardium 6, pain relieving and nausea relieving. Often it's used for when you have motion sickness point. So you put the InterX on it. You stimulate this point for a minute. And the second point comes in combination. It's heart 7. It's here underneath the, I think it's the styloid process. There is a little dip on the inner side of the hand, not outside, but inner side. But again, if you put the InterX like this, you will be able to detect it, to pinpoint. So pericardium 6, heart 7, called parasympathetic switch. You could do one side and the other. This is again to put people into this parasympathetic state. If people in severe pain, typically I would do one zone on the session and maybe next session, the others, the zone 2. So I don't do them all at once, but if they, you know, in sympathetic overdrive, but they're not in severe pain, you could do both zones in one session. Abdomen. So abdomen, don't only think of abdomen at the front, because innervation to the abdomen comes from the back. So what I normally recommend you to do, put them in a sitting up position and scan all the lumbosacral area. And you will be able to find and pinpoint some problem, some sticky points or high readings, if you take readings points, associated with some processes in the back, which then in turn, what's happening when the nerve is compromised? Let's say people have disc on the, let's say disc, lumbar 2 disc, yes. So what's happening? The compression of the disc is out. The compression will be more on the nerve which comes out of lumbar 2 and innervating the structures. I know lumbar 2 innervate kidneys, but it also some branches innervate stomach. Yes. So lumbar 3 also goes towards the hip, but a visceral tone will innervate branches of the intestine. So what is happening when the nerve is firing excessively? That part of the bowel become contracted more. Yes. And when it's a very big disc hernia, let's say at the back, the bowel will stay contracted for a long period of time, and it goes and creates strictures. Strictures is narrowing of the bowel. And when bowel has a stricture, it's also the scar tissue goes, so there is not proper propelling of the food, and food can be, you know, stuck in a, like in a pipe. Imagine all food is pushed and it's really narrowing. It's like a new traffic jam example. So when you scan with your InterX device all of the abdomen, and remember we're going to go into clockwise way, and we look for any sticky point. The sticky point will indicate to you where the strictures are. So then you just target it, and then 4-directional sliding technique will help to get rid of it. I have a lot of naturopaths and therapists who deal with irritable bowel, colonic irrigation therapists who use InterX on as a daily routine in the practice, and they report all how strictures recover if they use InterX device, and they use, of course, back and front. Okay, so typical preset for you will be either 30 to 120 because it's normally chronic, or 15 to 60. If there is a proper stricture, like a really hard stricture, you need to use low frequency because it breaks down the scar tissue. So, so we treat active sites and alarm points. Probably you just need to know one alarm points, which is very easy to find. It's on the projection of the liver. So you see this floating rib, number 11. So if you touch the end of it, do it on yourself now. Touch the end of the floating 11 rib. Do you feel unpleasant, like painful sensation? So if you do, this is called liver alarm point. It means your liver needs help. So go and InterX your liver. Okay, so you can palpate all the alarm points. There's some alarm points in the stomach. You can Google them. So now I'm just going to quickly to explain you Neuro-point protocol, and this is a protocol to target specific points on the body. So they are, you can see in the order from 1 to 24. This is I have somewhere reference for this research done by Dr. Ma and who at Dong, and they identify the source points, sore points, trigger points in the body, and they found the distribution is really linked to their the more chronic condition, the more sore points people have. So they identified bilaterally 24 points, and they used acupuncture on those points, and the effect was phenomenal. People would recover from whatever illness it was. So we took this research and we thought, how many points can we get away with? And we found that if we do first 12 bilaterally points, which total will be 24 points, it will take half an hour of your time. You actually will be able to shift this pain. And indeed, in reality, it proved itself. So I want to share with this protocol. So use chronic preset, either 60 or 15 sense of vibration, and go with each point. And on each point, you need to hold the device until you feel this spreading tingly sensation, and you hear the point sting beep. And then you move to the next one. But that spready buzzy sensation, it's the must, you must feel it. So this is the actual protocol itself here. So you could see all anatomical position and location. And so very quickly I run through it. So position number 1, it will be deep radial here in the elbow. Position number 2, in the between the jaw and the sternocleidomastoid. Position number 3, in this in the trapezius muscles, following the spinal accessory nerve. By the way, all positions are named after the specific nerve being stimulated. 3, position number 4, it's a saphenous. It will be on the tibia here. So on the tibia, you need to run your finger from there, from the knee into this point, right in the middle aspect of the tibia. But 5, it's your liver 3 points in between, in the web between 2 toes. 6, it's a point on the spleen. Palm width in the inner aspect of the inner leg. 7 will be occipital points here, attachment of the trapezius muscle. 8 will be in infraspinatus. 9, it will be on the arm, on the outside of the crease of the elbow. 10 will be on where the calf muscles split into both two, right in the center. 11 popliteal either here or the other side. And 12, of course, your famous large intestine 4 in the web between index and thumb. So this point. And lastly, source point protocol for you, where source points you need to do when no pain, okay? If you just want to balance, because each meridian has purpose and it's good energy, and each meridian also associates with the function. So when the energy, remember, overall go down, so you need to like refill with energy. So you put InterX stimulate to specific points, they call source points. They have a memory of the meridian function. So when you fill up with energy this meridian, then you have enable each meridian to function in a regular way now. So they all around the wrist, 1, 2, 3 points, and behind this here, right in the middle between 2 tendons, and right in anatomical snuffing. And on the foot is the same, just by the malleolus, just by the joint of the small toe, in between malleolus and like a dip right there, by the big toe joint, and this is liver 3, we know, in between web, and this is between second and third toe. So these points need to be stimulated in a very similar way at preset 60, and you just typically do both sides, 24 points It will take a while, but very good to do in patients who really don't suffer with pain, but have other serious illness. And lastly, I give you the diagram for the reflex zones. So with this diagram, you could see how to slide the device, and you could see, okay, heart, liver, liver here. If it's sticky, you just do the same point stim for directional sliding technique. And you could do the same with the feet. So use this called sujok forms. And now just to remind you that when we deal with hypersensitive patients, yes, they typically tell you also the pain is burning and throbbing. So the treatment will be still 30 minutes because they're in pain. You don't want to overstimulate them, but only once a week. And low presets, 15 to 60. Sense of vibration. Always starts with head, use parasympathetic zones and neural points. This is a protocol for now. Anyway, I'm just gonna give you a few more minutes just to, I know we finished the time, but there are a few case studies I'd like to share very briefly. So you would understand what it can be effective on in addition. Remember, it's a neurostimulator, neuromodulator, so any damage to the nerve can be repaired. So this is a diagram representing a chainsaw accident when the chainsaw went all the way to the bone, and they was surgically repaired, every capillary, every blood vessel and nerve. And the patient was left, like you could see demarcation line between the projection of the radial nerve was completely numb, and there is no innervation to the blood vessels. And you could see the ulnar nerve is more or less functioning. So when I took him, we worked for 9 months, and he had, of course, personal device, but we restore his, you could see on the diagram how much more capillaries become even on the slides below after 9 months. So you can repair, and the numbness went, and this man used it for the next few years, and he completely repaired. He got sensation absolutely everywhere. He's using his thumb completely. Disc hernias is very frequent condition, so that's where I would definitely recommend to use InterX device. But mind you, you can also, like Beth described, when you stimulate too much in one point, you can increase pain. So for this reason, don't focus always on just the point of this hernia. You want to redistribute it. So use the whole bigger area, use the mirror reflection area, contralateral. With complex regional pain syndrome, you can get results as well. You can see in this case, there was allodynia, different color, discoloration, foot gone very cold. So this is all gone when you use the InterX device. And even though she had 3 years neuropathic pain and allodynia, we managed probably within 6 months, she didn't need to come back, treated her. This is another complex regional pain syndrome, also to show how much we improve blood flow. Can you see on the left diagram, there is a blood not flowing into the toes on the right foot. And 4 sessions later, you could see the blood is flowing, so the cold disappears. Of course, came with the price. You can see white, it's a heat, aggravation of the heat, it's inflammation. So she had re-inflammation on the leg, which is good because we needed to complete the inflammation and finish with that. So eventually she recovered, she didn't have pain. And this is Bell's palsy. You can see very clearly how the Bell's palsy, and with this lady, it was literally 2 sessions because it was very fresh, and she came almost on the same day of the Bell's palsy stroke her. And so 2 weeks later, look at this, all symptoms recovered. So the clinical studies I'm going to include, there is a graphical representation on the different situation, pain relief, motion, and against sham device, pain edema against sham device, study the comparison results, total knee replacement, healing. You can see how it impacts the collagen, vascularization, and comparison with TENS on release of cytokines, release of having pro-healing and anti-inflammatory simultaneous effects on the body, effects on endorphins, effects on the brain, where we record their synchronization in all rhythm delta. It's a healing rhythm, appearance of alpha, reduction of tension. So we have a few evidence with the neurofeedback as well, how delta, you see this gray, increases throughout the treatment and then decreases in all this stress, high beta stress level also decreases. And this is representation of before and after InterX. That's why if people always say, I feel tired, fatigue, because when they come and brain is very, very active after InterX, look how quiet the brain becomes. So the brain can effectively hear what the body is reporting back because there is no noise. So that is effective treatment. And this is a treatment basically confirms that we have produced central mediated effects when we use InterX device. And feeling fatigue, it's not fatigue, it's a relaxation of the brain. The brain goes quiet, relaxed, sleepy, rather than fatigued. You're tired because the body puts you into parasympathetic state. And lastly, one paper on plantar fasciitis, if you're interested, compared to shockwave therapy with significantly better results and high satisfaction score. Okay, so I think I'm going to go back to us, all of us.